Welcome to Brockley News, the programme where we keep you updated on all you need to know about what's going on in and around the hospital. I'm Ron Laver, and yesterday the 16th of April was World Voice Day, and in a few moments we'll be hearing from RNOH speech language therapist Sarah Morgan. Later we will also be talking to Norman Sharp, who has the distinction of being in the Guinness Book of Records for having the longest lasting hip replacement, having lasted over 66 years. Then at 7:30 tonight it's Bedside Bingo with our very own Voice of the Balls, Dave Rouch, which is followed at 8 p.m. by your requests. So stay tuned to Radio Brockley, London's longest running hospital radio service and currently the holder of the Hospital Broadcasting Association Gold Award for Best Hospital Radio Service. We are the UK's number one. So, yesterday was World Voice Day, and here's Keith Reeve to tell us more.
World Voice Day is a worldwide event that takes place annually on April the 16th and is devoted to the celebration of the phenomenon of voice. Its aim is to demonstrate the enormous importance of the voice in our daily lives as a tool of communication and as an application of a large number of sciences such as physics, psychology, phonetics, art and biology. It was initiated in 1999 as a combined effort of American and European ear, nose and throat specialists and speech and language pathologists. Now, the celebration of World Voice Day is global, including concerts, symposia, open house at voice clinics and voice education institutes, TV shows and radio programmes. Talking of which, I'm joined by Sarah Morgan from the RNOH Speech Language Therapy Adult Team, or SALTS. Hello, Sarah.
Hello, how are you doing?
I'm very well, how are you?
I'm well, thank you.
Great, thank you very much for sparing the time to speak to us on Radio Brockley today. Now, what exactly, or who are exactly, are the Speech and Language Therapy Team here at the RNOH?
So that's a good question. So we're quite a small team that work at this hospital, and in the adult team there are 2 clinical staff, so myself and Hannah Chalk, and then we're also fortunate to have a research fellow within the team, Jackie McRae, who's actually doing her PhD at the moment. So as a small team we are very busy, so we cover all of the wards in the hospital, and our predominant work or specialty is working on spinal cord injury unit, on the intensive care unit, and then following any elective surgery, particularly around the spinal area.
Okay, so what exactly do you do when you're here at the RNOH?
So it's quite a varied day-to-day, so predominantly lots of clinical work, so I'll be going onto the wards, seeing patients, whether they be new or old patients, particularly helping anyone that might have difficulty talking, communicating, and also as part of a speech therapy role we also do lots of work looking at people who might have difficulty eating and drinking. So it can be a bit confusing in the title when I say I'm Sarah from Speech and Language Therapy, I'm here to help you eat and drink, but essentially we use some of the same muscle groups that we use to talk as we do to eat and drink, so lots of work around swallowing, nutrition and making sure people can eat and drink safely.
Right, because I was looking at some information online about this, and it was saying that apparently when you use your mouth for whatever purpose, speaking, eating, is over 100 muscles, is that right, that actually interact?
Yeah, so for swallowing, slightly less muscles, so about 35 pairs of muscles, different nerves, all innervating to make you swallow, so moving food, drink or saliva from your mouth down into your food pipe, and it all happens very quickly, and it's something that probably we all take for granted, so we never think about it. We've all had our breakfast this morning, our lunch, we'll have our dinner, and it's often a big social event for us in our culture, and when all those muscle groups work together we happily take food and drink down into our stomachs and don't think about it. If you have an injury, say to your throat or to your spinal cord or some surgery that you might have had, and one of those nerves or muscle groups isn't working properly, then we need to make sure that things aren't going the wrong way down into your lungs or making you unwell. So as part of the team we'll assess that.
So I guess something people perhaps don't always appreciate, you know, people have difficulty with muscle functions when they have a stroke, for example.
Yeah.
But possibly spinal injury is something that people don't always consider as having an effect on people's ability to speak or eat or drink properly.
Yeah, absolutely. And Jackie's PhD at the moment is actually looking at swallowing problems in spinal cord injury, how they are assessed and how they're managed. And we do lots of work in the trust looking at research, presenting at conferences, because you're right, it can be often quite subtle and people don't necessarily think it could be affected, but it can be quite devastating for patients not to be able to eat and drink. Not be able to go for a coffee with their family or have to be reliant on tube feeding. So we aim to restore eating and drinking as safely and as quickly as possible.
Yeah, okay, I can understand that. I can imagine from my own personal point of view that if I was unable to do those things which you take for granted, that's a really negative effect on you, isn't it?
Yeah.
If you can't do something you've always done all your life.
Absolutely.
So what type of patients typically would you see here? You touched on the Spinal Cord Injury Centre, which of course we have a lot of people here with life-changing illnesses or injuries. For the first time they're unable to do things that they've done for all their lives, maybe playing a sport or riding a bike or something like that. So what kind of things do you find mainly do you impact on up there?
So as I say, we work a lot on the spinal injury unit with spinal cord injured patients. We also see patients who've maybe been on intensive care unit who are very unwell, may need help from a breathing machine or a ventilator or a tracheostomy, which is a tube in the neck to help them breathe. So we work closely with those patients. Also just elective surgeries, so maybe people that have come in to have some surgery on the neck area, we'll work closely with those maybe before and after surgery, looking at all manner of things. So as I say, the eating and drinking side of things, can they effectively communicate? How does their voice sound? Has that been affected? And we often see patients depending on need, but because we're here Monday to Friday, we can see them every day if we need to. And we're quite fortunate to come up with intensive bespoke therapy packages to really make a difference.
Right, okay. And I can see that your group, though, only specifies adults. So what happens about the children here that are patients here at the RNOH? It's
a good question. So as I say, I sit mainly within the adult team. We do have a paediatric team here, so paediatric speech and language therapy. Sophie Scott is the lead for that team, and they see anyone under the age of 18. Because some of our patients here are lifelong patients, we often do work closely with our paediatric team, and those individuals transitioning from children into adults, then we'll often do handover to make sure that process is as seamless as possible. Because children and adults sometimes anatomically or behave a bit differently, that's why we have different teams, because the speciality is different within that. So although myself and Sophie share the same title, speech and language therapist, I'll have certain skills she doesn't have and vice versa. So we do have a paediatric team children here.
Now we've already mentioned this a little bit as well, but for example, some patients that do arrive here at the RNOH have been unable to speak or communicate for some time. So how do you actually restart that process? I mean, what's the first stepping stone that you need to take for somebody who's had a major trauma, who can't now speak as they used to or possibly eat? How do you start the process?
Yeah, so we'll often look at, well, what's caused it? Is this something maybe that you were born with, so not acquired, not something that you've picked up through an injury? So we'll definitely look at what's the diagnosis, how was it caused, because that can give us some information as to, okay, is this going to recover or is this something that we're stuck with? Then we'll do some accurate assessments. We've got to know exactly what's gone wrong with the swallowing, or why isn't the person talking. Sometimes if people are on intensive care unit and they need to be on a ventilator and they need to have a tracheostomy in their neck, then just the mechanical reason, the fact that that's there, means they can't talk, which can be hugely frightening and hugely frustrating for a patient not being able to talk, because again, like eating and drinking, we talk all the time. It's how we form human connections, it's how we tell people how we're feeling. So we will possibly for a short term, if they couldn't talk, maybe use some electronic aids, or look at picture charts. But the aim is always to get talking or speaking back as soon as possible, because that's the quickest, most natural thing. So we work very closely with the doctors, the nurses, the anaesthetists, physiotherapists, occupational therapists to manage communication and swallowing problems in these patient groups. So it's very much a team approach, and we we'll do, as I say, assessments. We'll come up with therapy packages. We'll reassess, with always the aim to be get people eating and drinking again and get them talking. And we have quite good success rates with that.
That's brilliant. That's brilliant. Now, you mentioned just now, you sort of touched on some of the aids that you can use now. I mean, does advancing technology assist your work? I would imagine it probably would. I'm just trying to imagine ways that it could actually assist these days. Yeah,
so we are very fortunate here at the RNOH to have access to some really good state-of-the-art swallowing assessments. So we've got a little camera it's called a flexible nase endoscopy that we can put up people's noses and have a direct view into their throat, so we can see their voice box, so we can see their larynx, their pharynx, and that allows us to really get an idea of what their swallow and their voice function's doing. You can imagine if you just spoke to someone or watched someone eat, you could get some information, but without looking inside, it can be really difficult. And of, say, the 11 spinal injury units across the UK, we're fortunate to be one of the only sites that has access to that equipment, and it's really made a difference to patient outcomes. We can also access some of the communication aid stores over at Northwick Park Hospital to help with electronic communication aids if possible. But as I say, we'll always try and get speaking and talking as the first aim, and then use electronic aids if we need to. And we work closely with the Research and Innovation Centre here, Create and Aspire, who are doing some fantastic work with spinal cord injury and technology. And having Jackie as the research side of things in the team, we've got a really solid expertise clinically, but we're also now joining up with research to make sure patients get the best possible outcome. So it's great to hear that the RNOH, yet again, in a slightly different field, is leading the way. Absolutely. And the research and development that goes on here, I know it goes on elsewhere, but here helps front that development and progress the sciences that you're following. Yeah, and we've actually, myself and Hannah, have put together an abstract this morning looking at this swallow equipment, which we hope to submit to the International Spinal Cord Conference, which is in Vienna later this year. Wow. Will you be going? Hope, fingers crossed. I don't know. Smashing. So what do you personally mainly enjoy about working here at the RNOH as a speech and language therapist? What's the thing that gives you the biggest kick? I'd say it's the patients and the staff that I get to work with. So I've worked in a number of different hospitals before, in a number of different settings, so head and neck oncology, head and neck cancer, neurology caseloads out in the community. I really like the challenge and the complexity of the patients that we get here. I think meeting them and working close with them, they've made me a better clinician. I think the staff members and those in my team in speech therapy, in physio, in the dietetic team, the doctors, the nurses, we really do have a good working relationship. And I think if you've got that right and you've got a good team, then your patients will benefit. And working with the patients is a real privilege, really. And because we have long-term patients and rehabilitation, you get to know them very well. You get to know their family very well. We can try new procedures. We can try and be innovative, because there's not much research on speech therapy in this population of people. So in the absence of having big amounts of evidence, you've almost got to look and create it yourself. And no 2 days are the same. So, attending meetings, going on the ward rounds, doing clinical work, presenting at conferences, chatting to you on the radio. I've not done that before. So it's all very varied and a privilege, really.
Fantastic, thank you. Well, I'm pleased we've got a radio first from you. That's always nice to know. Thank you, thank you for that. Now, I know there's lots of things going on around the world on April the 16th to commemorate World Voice Day. Is there anything specifically going on here at the RNOH?
So we have done, we've recently been on Articulate, which is the RNOH magazine, looking at some of the work we've done. We've done a piece on the grapevine, which can be accessed by staff internally and also people out in the community, which documents some of our service a bit more, how to get in touch with us, the type of work that we do, and as I say, just being out on the wards and chatting to people. As I say, we always welcome people coming, spending time with us or asking what we do. And there's lots going on in London as well. So at the Welcome Collection, they've got an exhibition on called This Is a Voice, celebrating the voice and how we communicate, which has just recently started. I think runs into July, and it looks like a really excellent exhibition if people want to get down and see that.
Thank you, Sarah, for your time today.
Thank you.
And please keep up the good work here with the SALT team at the RNOH.
Thanks very much.
Pin back your luggles, ladies and gentlemen, boys and girls, grannies and grandmas. It's Richard Smith.
It certainly is. Hello there, and whether it's a walk in the Black Forest to the Zambezi or Abba to ZZ Top, you'll find it right here on the A to Z of Pop with me, Richard Smith, every weekday afternoon at 1 o'clock on Radio Brockley, where you'll see that the programmes are all about artist names or song titles that begin with various letters of the alphabet. And every day on the show, I'll be having a listen to some of the best songs and the biggest stars of popular music from the 1950s right through to the present day. So all you have to do is to just settle back, relax, and then join me, Richard Smith, with the A to Z of Pop, every weekday afternoon at 1 o'clock here on London's longest running hospital radio station, Radio Brockley. I'll see you later. Ta-ra!
This is Radio Brockley.
You're listening to Brockley News on Radio Brockley, London's longest running hospital radio station, serving the Royal National Orthopaedic Hospital in Stanmore since 1966. Next tonight on Brockley News, we hear from record holder Norman Sharp. Here's Keith Reeve again.
Well, I'm with Norman Sharp, who is now officially the Guinness Book of Records world record holder for having a replacement hip the longest. Norman, when was your replacement hip fitted?
The one we're talking about was fitted on the 1st of December 1948. Yeah.
And I believe you had both done in fairly quick succession.
That's right, and the second hip was done on the 22nd of December 1948, 3 weeks after the first, yeah. And that seemed to the surgeon the right amount of space between to let me sort of get me thing back together after the first op. But everything went so smooth. I've never known I've had them, frankly. So it's this is all so strange to me because I didn't know I was never interested in them. I didn't know I had them, and it's just strange that everybody else is so interested. So many people are interested. It's just seems strange to me.
It's a remarkable story, Norman. I mean, how soon after you had the operations were you up and walking around?
Now, after I had the second operation, Mr. Newman came round with his entourage, and his registrar that was with him said, "When can this lad go home?" And Mr. Newman turned to the sister on the ward, Sister Dawson, and this young lad is not to walk on those hips for 6 months. They've got to last him 60 years. And I didn't walk on them for 6 months. I went to the pool every day, went to the warm pool,
yeah,
exercising, physio and that. But I didn't walk on them for 6 months.
That was pretty much the standard thing in those days, wasn't it? They just didn't know how soon the bone would mend.
I don't really know, because those days I didn't know anything about hips. In fact, I'd had my hips done, and it was after the second one was done that they they brought the X-ray machine to my bed and took the X-ray with me in bed. And when the doctor came round after they took the X-ray, they held the X-ray up, and that was the first inclination of what I'd had done. They didn't even tell me what they were going to do.
Wow, so you didn't actually know you were going to have a hip replacement?
I didn't know. I never heard of hip replacements. And I thought, you see, I had a leg straightened up in 1939 in Great Portland Street. And I believed that, and we all got turned out of Great Portland Street, and 2 weeks later war was declared. So, and we were all sent over. They emptied the hospital. And I just assumed that Mr. Rockin Jones, my surgeon then, was going to straighten the other leg up in 1948 when they said the bed had been reserved for you. So I was expecting a leg straightening job. And when I came round from the first operation, that was my first surprise. Because when you came round, the first thing I did was to feel down my body to see where the plaster was going to start. Because previously it started just above your eye chest, and the next part of your body you saw were the toes. They left the toes out, they left my arms out. And it was just unbelievable. When I had the first hip, I came round and I couldn't feel where the plaster was started, and there wasn't any plaster. That was marvellous.
What a freedom you had there that you weren't expecting. That's fantastic.
Oh, that was a wonderful surprise. That was, because once you were in plaster, those days you were in it for about 12 weeks, and all sorts of complications come in.
Yes, I know. I can relate to that because I was in plaster for a year. So yeah.
You used to look forward to the day when the man came in with his big shears, and I do mean big shears. They were about 3 foot long.
Yeah.
Big, and they used to push it down the plaster, nibble a bit, and that was all right till they got to the ankle and the knees. Then they had to get them shears round the corner.
I do remember the big plaster jackets they used to use. They were very hot, very heavy, and very uncomfortable inside. Used to itch like mad, I seem to remember. Oh,
yes. I've still got the results of those plaster days. Yes, you often got plaster sores and one thing and another, and I've got a fair few of those where the old plaster the cotton wool would eat away after a while, and you were rubbing on the plaster. So,
well, that's a remarkable story. I mean,
that was yesterday.
That was a good yesterday, yeah.
That was yesterday.
So, have you enjoyed a full life with your 2 replacement hips?
Absolutely full. And it's only just recently. I mean, it must be a job to believe me. But as true as I'm sat here, it's the truth. I never even thought that I was disabled or had hips or anything. I never had any pain. I was, if I wanted to do something, I did it. I say, it must sound very strange for anybody that hasn't had a little bit of experience. But it's true. I never knew I was disabled or didn't had hips, artificial hips. I had all the boys had motorbikes because I was 23 when I had my hips done, and I was missing out on all that motorbike lark and all that. So I was able to get my motorbike, and once I'd had my hips done, of course, I could open my knees far enough to straddle the tank, and I was one of the boys.
You were away?
I was away every weekend.
Don't blame you. So you must have some wonderful stories of the RNOH back in the late 40s, and indeed 1939 when you were a patient in Great Portland Street. Can you remember a few?
In Great Portland Street, I don't remember much about. I can visualise the ward, and it was on the opposite side to the outpatients, opposite side of the road.
That's right.
And I used to lay in my bed and I could look out the window and I looked across to the outpatient side. And that's all I can remember mainly about that.
What about Stanmore? Can you remember more about the Stanmore site?
There was one little incident that happened in 1939. I did not like tapioca.
Hospital food, it has to come up at some point.
I did not like tapioca. I couldn't look at it, let alone eat it. And I left me tapioca one day, and Sister come along and saw it on the side. Oh, you must have your pudding. You must eat this food. You must have it. And I said, sorry, Sister, I can't eat it. And Sister picked up the spoon and proceeded to feed me with this tapioca. And I was a 14-year-old lad then, in 1939. And I had to spit it all out. And the only way that I could get the taste out of my mouth was to get some toothpaste on my finger and rub it all round my mouth, toothpaste to take the taste.
That's a lovely story, Norman. Thank you. So what wards were you on here when you were at Stanmore?
Hut 9.
Which one's that? Do you know now?
Going up the slope on the right-hand side, there were 5 huts, and Hut 9 was the middle one. It was 3 from the bottom and 3 from the top of the slope.
Okay.
On the right-hand side going up.
Right, okay. So that was one of the World War II Nissen huts.
Next to it was the operating theatre, I think. That'd be Hut 11. Yeah, I think that was the operating theatre.
Margaret Hart, we think. Yeah, we think that might have been Margaret Hart Ward, as it's now called. So, and it's still there, amazingly.
Yes.
So, built in 1940, still there to this day. So that's
right.
Fantastic.
They were put up when for the war, and to help ease the patients that were coming in from the front line and all that sort of thing. Yes, but they gave good service. They kept us dry anyway. We never had any problem and warm. Yeah.
Great. So have the Guinness Book of Records made a big fuss of you now that you're the official world record holder?
Well, to get this certificate, believe it or not, it took 6 months from when I first applied to when I actually got the certificate. Was 6 months later. So I've only had the certificate for weeks, almost virtually, and so it hadn't really got to my head yet, except coming up to Stanmore today. This is more lifting to me than the certificate, and talking to the people here about the hips and they're very forthcoming. If you've got a question, they'll answer it. And but years ago, you see, you were never discussed with the doctors and the sisters. They discussed you between themselves, but you were never involved. And that's why I didn't know I was going to have hips. I didn't know anything about it till after I'd had them.
Yeah.
They never involved you at all. Today, I mean, you're involved from the word go. You're told all about what to expect and how long and this and that and whether, success rates and all that. But in 1948, you didn't get anything like that.
No. It's a different world now, Norman, but you were a pioneer of the time.
Absolutely. I mean, in 1948, if there was a fire, you had to go to the village, to the centre of the village, and hope there'd be a phone box there. Today, you just put your hand in your pocket. But I mean, that was all comic book stuff back in 1948. All this computer. There wasn't 1948. There wasn't even calculators. We didn't even have calculators.
Yeah, it's a totally different world now, isn't it?
Absolutely. When when you had your Pythagoras to work out, you had to put pencil to paper. No tapping.
Norman, you're a remarkable man. Thank you for coming up all the way from Trowbridge in Wiltshire today to see us.
Well, thank you very much. You've all made the journey worthwhile, and it's been a pleasure. And I hope I can now repay in some little way, and perhaps help you get a few more bricks for that new building. And I'll do my best, give it my best shot.
Norman Sharp, thank you very much for your time, and all the best to you.
God bless you all.
Our thanks to Sarah Morgan and Norman Sharp, and of course reporter Keith Reeve. Stay tuned to Radio Brockley for Bedside Bingo with Dave Rauch coming up next. Your chance to win some Radio Brockley goodies. And join us again next Sunday for another edition of Brockley News. My name's Ron Laver, and until next time, goodbye.